let's see what was day 1 of week 1, so on Monday. So this is for my community placement. Ignore the roughness of this. So as the doctor is seeing patients, or as we are seeing patients, I'm also just jotting this down so that when I then do my logbook entries, I don't have to go back to the system. I just have it on my iPad and I can just do that, so it's easy. So patient 1 was a 57-year-old female. She just came in complaining of tiredness. So actually my doctor, we're gonna call him Dr. S. So Dr. S said that I should actually go and read about tiredness, because the number of people who actually come into clinic complaining of tiredness is amazing. So you need to be thinking of, your B12, your vitamin D, your iron levels. What's the other one for tiredness? I've said iron, I've said vitamin D, B12. There's 4. I don't know. We'll come across it anyway. Yeah, she was feeling dizzy today and she wanted a medical certificate. She had also actually driven for 4 hours to come and see my special doctor. So like everyone else who comes in, we cleared her because of, we checked her BP, nausea and vomiting, cleared of fever, the temperature. And what I'm liking, guys, is that I'm like I just sit there with him, and when a patient comes in, I just kind of suss out what the problem is. If it sounds like it's an infection or whatever, I will run for the temperature, and then we'll check the BP, we'll check this, we'll use the oximeter for the SATs, for the oxygen saturation. Yeah, so I'm like his little handy girl at the moment. So it was a non-specific diagnosis, and don't be surprised, because I think even from our clinical skills, Prof was saying that even if you go through, even for OSCE cases, even if you don't get the diagnosis right, as long as you follow the right pattern, you will still pass. So diagnosis here, you can see it was non-specific. We of course advised her on water, on exercise, on rest, but of course if someone comes in with all of these, we kind of ask about the family. And guys, just remember, I'm not following I'm not following that guideline that we were using, like when we were doing the clinical skills. This is all random. I just want to show you the case files that I've come across, so you can be able to capture what type of conditions we come across in community. So there's nothing here, it's random, it's a mess, but just get the conditions, get the idea. Yeah, so she did say that the family had been sick, so it could have been a viral sickness, who knows, but we gave her medical condition certificate. That's patient 1. Patient 2 came in. It's a he had a mental history of schizophrenia, psychosis. He came in just saying that he had low mood. He was 34-year-old male. So he had been discharged from hospital, and they had just said that to continue management with his doctor, and he was already on sodium valproate, and then injections every 2 weeks of zuclopenthoxol, which is this one. And so obviously the doctor was just going through his file to see, okay, from the latest admission from hospital, they've stopped you from these meds, now you are not on these ones anymore, and he did say that he lives by himself, he was barely managing, and he was kind of just wondering if they could organize NDIS or Centrelink papers, which Dr. S did manage to organize these. And then the NDIS, I think the psychiatrist had already started that paperwork. Patient number 3, this one came in with sun damage, actinic keratosis, 78-year-old female. So this lady actually came from 4 hours drive away, but that's where Dr. S used to work. But because he's also really good with oncology cases, Dr. S used to be a trauma surgeon, and yeah, so he's also into oncology, so he's done a lot of these. So this lady follows him around, I think. So she had a skin lesion on the leg, but on the day, did did we exercise on that day? No. This was my day one. So we didn't exercise, but this she had some exercised before. So on this day, I think we just used that nitrogen cryotherapy. Liquid nitrogen to just freeze it, and then gave her some antibiotic. This one was just me just wondering, risk factor for melanoma. Of course, we are the world's capital, right? But yeah, look, just like anything else. Patient 5 was a 25-year-old female who is a sex worker, and apparently every 3 months they need to come in for STI checks. She also was following up on some previous investigations, but her main concern on this visit was that there was a polyp that was found in the endometrium, but she did say that now it was affecting her work. So she had pain in the lower abdomen, and she never used to get this pain before, but now she said that it was affecting her work, and she usually works 4 days a week, 10-hour shifts, and the last shift that she did, she had to go back home because of this pain. And yeah, so we did a referral to the urologist and to the gynae. So we'll follow through post those referrals because she was really keen to see the gynae. Patient 5, 70-year-old female. She came in for Shingrix, so this one, I actually need to look at the guidelines for giving shingles because I'm not quite sure of the age. I'm not sure if it's above 50 or whatever. This was my homework. I actually did this homework, but right now I can't recall. So this one, it's good to see there's a handbook, the immunization handbook, which you can see the guidelines. Patient 6 was just a 36-year-old male who just came in for a script, which is just for PPI. Lots of GI issues, by the way, in community placement. Patient 7 was an 82-year-old female with chronic pain, nil relief from a lot of the analgesia. She was wondering, she was wanting CBD oil to kind of help with that. So she was given Palexia, and she was going to see a doctor in the clinic who is able to prescribe CBD. Patient 8 was a 58-year-old male who was sore on the right hip, query hair follicle infection. It had been there for 2 weeks, and now it was turning into a deeper purple color. It did look like it was infected, so we gave him antibiotics to come back if this didn't clear. 14-year-old female was patient number 9. This one also hypertrophic keratosis, left earlobe. Since she tried to pierce it. They actually came in still with both studs in situ. The mom herself, her earlobes were not pierced, so she said she had no idea. It was inflamed and red and swollen, but still the stud was still in there. So the mom said that she didn't know how to do it. She didn't know how to pull so I had to do it. I had to pull the stud and the stopper out, and then I had to show her how to do it because she really said she was clueless. I thought it was a keloid, but we were not sure. Also, the Dr. S thought it was more a foreign body localized, because if you palpated, there was this, it was like the size of a stopper that was in there, but still I managed to get the stopper and the stud out. So I'm not quite sure. It could be just tissue granulating under there, who knows, but sent for ultrasound. We shall know soon. Also, know your types of rash. Lots of people coming in presenting with rash. Patient 10 was a 44-year-old male. HbA1c was 6, so he was pre-diabetic. I think the treatment was exercise and diet control, but also tamisatin was given. Patient number 11 was a 64-year-old female. She said that she had lots of problems with her ears, and there was earwax. We looked in there, and there was lots of earwax in there. She said she had tried ear drops from the chemist, but anyway, we ended up doing some ear stringing, which was really cool to see. yeah, so you need to warn them. Even doing such a minor procedure like ear syringing, you'll be thinking it's nothing, right? But you need to warn them, because some people apparently they can end up even having fits, like a seizure. So you need to let them know, of the side effects of any procedure, even if you think it's very minor. Even if the side effects are very rare, you still have to tell them. Patient 12, 39-year-old female, RSV for 7 days. She needed medical clearance for work. Yeah. Patient 13, 39-year-old female. Yeah. Anyway, never mind. This one didn't want a student in. Out of my 5 days in community placement with almost 30, 40 patients a day, there was only one person who didn't want to see me, and it was patient 13. And no grudges held. That's okay. Only 1 out of a million. Patient 14, 69-year-old male who had been to India, came back, chesty cough, and I auscultated, and he had biobasal crackles, and he was given doxycycline because of his recent travel. So he explained that we were trying to cover the atypical bacteria. So it's very cool to practice my auscultation, because I do musculoskeletal type of work. I only get like one chest condition every couple of months. So with being in the doctor's office, I literally have to listen to maybe every third patient I need to auscultate. Patient 15, 25-year-old female, came in complaining of dizziness. She had hit her head, like a metal pole fell on her head at work. She didn't pass out. She did have headaches, and she had blurred vision as an immediate symptom when it happened, but now she was fine. We checked her vision, and from the classification of classifying your concussions, because she didn't pass out right away at this time of incident, we ended up with a mild concussion. So we did, because she's work cover, we gave her a few more days of work, rest, electrolytes, and then to come back in. And we did follow up with her later on during the week as well. You will see. Patient 16, 73-year-old female, big toe and little toe pain, also kind of plantar fascia pain. I was just like, this woman, her pain was kind of non-specific here or there, here and there. It wasn't just the big toe and the little toe pain. It's kind of non-specific. We couldn't really suss or pin it down. I thought fibromyalgia. Dr. S doesn't really believe in this. He says it's not his thing, chronic pain and all of this. So anyway, we referred this person for physio, so they can do further assessments and treat whatever her main complaint is. Patient 17, 35-year-old male, came in complaining of shoulder pain with the right shoulder sling was in situ, and then he also wanted a mental health plan. So we did the shoulder assessment. This person had surgery of some sort, so he was still having it immobilized. Patient 18, 46-year-old male, diagnosis hypertension, gout, knee pain, ankle pain, swelling lower limb, which was pitting for more than 2 weeks. Now I can't remember what we did with this one. I'm going to keep going for the sake of progress. Patient 19, 12-year-old female, dizzy for 1 week duration, couldn't see clearly, fuzzy, tired, headaches, and she wears glasses. We auscultated NAD. But now I don't even know what the intervention was. Okay, Karen, think right now. She was dizzy 1 week, can't see clearly, tired, headaches. I don't even recall her being dizzy when we saw her. I remember the eye test, she was fine. We might have maybe sent her for bloods. Patient 20, 35-year-old female, intellectual disability. This one, the relative died in December. A relative who was close to her was stabbed by a co-worker. I actually remember seeing this case in the news, so we referred her for counseling. Patient 21, 23-year-old female, she just wanted a blood test. Also, we thought that we could see some tinea on her, so we gave her we gave her some scripts anyway. to go antifungal. I think it was the shampoo that we ended up recommending for her. Patient 22, 32-year-old male. He came in just saying that one of his toes was going black. So we treated it as a fungal infection. Patient 23, 35-year-old female. She came in saying that the cough is still there. Clearly, I had not seen them before. And they had been on antibiotics for 1 week and they were not better. So she wanted a specific medication because a doctor from the Philippines had prescribed this before and it had worked for them. So yeah, that's what we did. And yeah, I think when we auscultated her, actually she did have some bronchi, upper lobes. So we thought it was an upper respiratory chest infection. Patient 24, 7-year-old male, right upper arm wound. It had been 3 months, new skin. Oh yeah. This one, 7-year-old boy, he was actually overweight, and he had a skin excision done, so you could see that the tissue had not, the skin, the upper layer had not completely come to cover the skin. The wound wasn't open, but of course because of the excision, now it was like the bottom layer of the skin, but it was still covering. But of course that means that the nerve endings are still there, right? So it was sensitive, so the dad felt like it had not healed, so we had to reassure him. Also, they were following up on some blood. There's a lot of following up of bloods or scripts and stuff. So the boy had fatty liver. I was concerned because he's only 7 years old, but the doctor said that he had referred them to see a dietitian and also advised the dad to continue helping his son on his weight loss. Patient 25 was a 26-year-old male. He came in with red eyes on the left eye. For a few weeks, he said there was no pain, no watering. Vision was okay. So we referred him to see an optometrist for a slit lamp exam because the doctors thought it could be pterygium, but we don't know. So we will see what comes back. So this one, it's more when your eyes are, you expose your eyes to sun. I know this because my mom had this surgery many years ago. So yeah, so I don't know, this is only 26-year-old, but again, I'm sure it doesn't matter how old you are, but I think it would be more common maybe older people, because I remember my optometrist telling me one time that one of my eyes looked like it had this pterygium, but then he said to me it's more common in people who are more than 50. Patient 26, 50-year-old female. 56-year-old female. Okay, this one came in for heart health assessment. So with this one, guys, it's like MBS. You can check item number 699. There's a lot of item numbers to know as well, to know what you are doing, but this one is an overall check. So as you can see from the notes, we did the lot, everything, right? Yeah. You get the smoking history, you check the heart rates, you check everything, blah blah blah. And then we did refer her for ECG as well. Patient 27, 30-year-old male. They had moved house, but there was allergy. I remember him very well. He didn't really know what was happening, what was causing his symptoms, but he had allergy type symptoms, right? He had like non-stop sneezing, runny nose, sore throat, cough. He had no fever, but he had just moved in to go live with the girlfriend, and the girlfriend had a poodle. So then the doctor said there's 2 ways you can cure your symptoms. You can go and get rid of whatever is causing the allergy, so get rid of the poodle. Clearly the doctor was joking, but this patient had a straight face and he was actually contemplating going to get rid of the I'm like, that's your girlfriend's poodle, you will break up pretty quick. So anyway, he got some of course we sent him for the rust test for allergy, and I think we did advise him on some of the like Telfast over the counter, I think. Patient 28, 27-year-old male, middle finger soccer injury. So he says a ball just hit the middle finger. It was swollen. We sent him for an x-ray. He was able to move his fingers. He was able to make a fist, obviously not pushing too hard, because at this point we don't know whether this patient has a fracture or not. But it was swollen, slightly red, but just slightly swollen, not like a huge swelling. And the pain, of course, was very, like, the middle part of the finger, so between the PIP and the DIP, right? It was really painful. So I was wondering whether it was this joint or somewhere along the shaft of this little bone, right? So he was sent for x-ray. Right now I know what the results are. You could try to guess, but it will be on, I think, day 5. Patient 29, woohoo, last one. 26-year-old female. She came in for a vaccine check. Okay, follow up on bloods. There's a lot of this, by the way, following up on bloods. And then patient 30, 18 months, female, rash on chest. We thought query eczema. Treatment was a steroid. This is moderate strength mometasone. So we shall see how that goes. I'm sorry, guys, the notes are really patchy. Believe me, this was day 1, so my head and my heart and everything was all over the place. I promise you it gets better as the week goes. So I should have better information and better guidelines and more information for you.